So the World Health Organization and the European CDC, the Centre for Disease Control, have both changed their opinion on masks. In March, neither the World Health Organization nor the European Centre for Disease Control were in favour of masks because we didn't know enough about the virus to know that it was different from any of the other viruses we've had. With previous viruses, you're not infectious until you got symptoms, and the idea was if you've got symptoms, then you shut yourself away. What we've seen since then is that there are several things that are different about this virus than almost any other virus we've seen. Firstly, you can be infectious for a couple of days and you can spread the virus for a couple of days before you get symptoms. And secondly, you can spread it by aerosols, which means that by breathing or singing and so on, you can spread it rather than just by coughing or sneezing. So you're quite right, Carole, in as much as there is a risk of self-contamination, and that risk hasn't gone away. But before, until we knew more about this virus in March, when both the European CDC and the WHO and I were sceptical about masks, it was because there was no evidence of benefit. What we've now seen is that there is benefit, and the benefits outweigh the risks. Now, if we look at where the risks are likely to be highest, if you think about it, you are 20 times less likely to spread the virus outside than inside. But then again, the very high-risk areas have got a risk of a number of people infected, which is 20 times higher than the lowest risk areas. So actually, you're getting the same protection from wearing masks outside in the high-risk areas as you're getting from wearing them inside in the very low-risk areas.
Can I just tell you, you must have heard of a guy called Professor Carl Hennigan. He's arguably one of this country's top epidemiologists. Let me just tell you what he says about masks. He says, by all means, people can wear them, but they can't say it's an evidence-based decision. He says there's a real separation between an evidence-based decision and the opaque term that we are being led by science, which isn't evidence. So this is one of the country's top epidemiologists. You also
so there have been several studies
let me finish.
In the last 3 or 4 months.
There have also been lots of controlled, randomised trials which say they don't work to prevent illnesses being transmitted by droplets or by aerosols.
But they can't do any harm.
But they don't do any good. You know, and the thing is, we do harm. You know, have you seen the way people wear masks?
No.
People who wear flimsy piece of cotton across their. Let me just finish this point. They wear a flimsy piece of cotton across their face. They move it up and down all the time. If the virus is there, you're going to contaminate yourself.
All right,
so 2 things. 1, Centre for Disease Control, World Health Organization, the Lancet, the British Medical Association.
Where's their evidence? Where is the British Medical Association evidence?
The fact that several studies have been done which shows that states in America where mask wearing was introduced had lower rates of infection. That's happened across the board in several different countries. But I think what the crucial thing that we need to get our head around is, yes, the evidence that a mask will protect the wearer is sketchy, but the evidence that mask will prevent transmission to others, that is pretty established.
If you cough or sneeze,
and the crucial thing here is people need to get that this is about protecting other people, because people think this is about protecting yourself. They're walking around without a mask, thinking they're being brave and not.
Let's go to call.